Hello, I'm Dr. Paul Anderson from Advanced Medical Therapies in Seattle, Washington. I get the question a lot, why, after all of the years and all the different clinics you've been involved with, did you essentially reset and start a new clinic? Well, the purpose of Advanced Medical Therapies was to take all of the 3 decades worth of work in medicine prior and put them all together. So in the forming of Advanced Medical Therapies, we of course have advanced processes, we have advanced protocols, many things that I have learned over time. And the important part about that is not just to have a collection of protocols or procedures or even sequences of procedures, but what I saw over especially the last 10 years was if you can sequence and have synergy with the procedures and the protocols, you can gain a lot of therapeutic and clinical benefit. So at Advanced Medical Therapies, we have the ability to have advanced medical procedures all under one roof. We are able to provide advanced intravenous therapies, hyperthermia, hyperbaric oxygen therapies, oxidative therapies, and many, many other therapies that are helpful in cancer and chronic illness. We also have a fully compliant pharmacy-grade clean room for all of our sterile medications and compounding. Another key ingredient that I found over the years that we're incorporating in Advanced Medical Therapies beyond what we do is the people that we have providing service and care to people. I have found that the human element is probably one of the most important things, not just from the skill of the clinician and not just from the technical knowledge, which certainly is incredibly important, but also their ability to care and have empathy. And in the end of the spectrum of chronic illness and cancer, people are in such distress and people are often so disturbed by the diagnosis that they've had that without that element, you lose a lot of the ability to care, but also the ability to personalize the care for your patients. So in Advanced Medical Therapies, our goal is to take the technical portion, which I have been working on and developing for all of these years and literally learning every day, and combine that with an excellent care staff and an excellent care system so that we can provide the very, very best regardless of where a person is in their journey with a chronic illness or if they happen to have cancer. It's that orchestration and synergy that I've found over the years that takes the care from ordinary to excellent, and that is really our goal at Advanced Medical Therapies. I've asked, which we usually go through in the very beginning with a patient, is what about what I've heard from all of my other healthcare providers or maybe family and friends and other well-meaning individuals about what I ought to be doing or ought not to be doing. And one of the common things that comes up is, say your primary care or other specialist healthcare provider may have already given you a care plan or their ideas of what the best thing to do is. And the important part about that with our clinic is we meet you where you are. If you have a plan already in place that appears to be the very best thing for you, our goal then is to support you and that plan in the very best way possible. In other cases, we have patients who come in and their other provider says there's really nothing else we can do. And in that case, we have a completely different approach. And I think that the most important thing, and this is again something that we've learned over the years, is that when we meet you as a patient where you are, whether you have an advanced chronic illness or cancer of any type, we do the very best medicine for you. And that's a decision between you and your healthcare providers. And that's a piece of the puzzle that we can provide that is not available very many places. Another question I get asked about Advanced Medical Therapies is, why is your clinic so hyper-focused on the care of people who have cancer and advanced chronic illnesses? Why don't you do more things or variety of treatments and therapies? Well, part of the answer is we actually do a great deal of treatment and therapy. We have a lot of things available that are not available at other clinics or very rarely available at other clinics under one roof. But really, we have very purposefully focused on the very best of the therapies that help patients who have cancer and chronic illness that I and my staff have the very best experience and training in. So while there are many things that we purposely choose not to do or include because we have colleagues who can provide those services and we work with many other clinics, our goal is to focus on the things that we do best and that we are the very best provider for so that we can provide the best care to a patient who has cancer or chronic illness.